A curved or phased array transducer with an abdominal exam type is used to perform a renal ultrasound exam. The kidney should be evaluated in two planes. The transducer is placed in a long axis orientation along the left posterior axillary line at the costal margin, with the orientation marker directed toward the patient's head. The left kidney lies more superior and posterior than the right kidney. Therefore, to adequately visualize the kidney, it may require moving the transducer superiorly to an intercostal approach and posteriorly from the mid-axillary line. Having the patient take a prolonged deep inspiration will move the diaphragm, spleen, and kidney down for easier access. The right lateral decubitus position may also be used to move obscuring artifacts from the stomach and intestine away from the kidney. Once the kidney is identified, the transducer is slightly rotated to adjust for the oblique orientation of the kidney. The transducer is swept from anterior to posterior to image the kidney parenchyma, which will appear hypoechoic when compared to the spleen. The renal pyramids are triangular in shape and darker or hypoechoic than the renal cortex. The renal pelvis will appear as bright hyperechoic echoes within the kidney. To obtain a transverse axis view, rotate the transducer 90 degrees from the long axis position. The kidney appears as a circular structure with a horseshoe shape at the level of the renal pelvis. The transducer is swept from the superior to inferior poles to evaluate the entire kidney.